Makes perfect sense. Um, I wanted to ask you the role of supplements. I believe treatment, of course, along with the long-term solutions, which is, of course, just as you said, eating real foods, practicing mindful eating, having a good relationship with food, exercising, low
Yeah.
stress, sleeping well. Those are the kind of the meat and potatoes, proverbially. But the sometimes what we have tendency to do, and this might be a credit to just the marketing strategies of supplement brands. They kind of sometimes the narrative is we need a certain supplement or we need a certain tincture, and that will supposedly heal all our problems. Now, in terms of medication that we are ingesting, I believe there's two. One is a bit of like maybe the harsher medications where we see maybe like the antibiotics and the steroids. And then there's maybe on the other end of the spectrum, you see this rise of nutraceuticals and supplements like natural herbs, um, like natural herbs, bacterial strains, probiotics, prebiotics. Nowadays, we're seeing like prebiotics, probiotics, and postbiotics all in one.
Yeah.
Um, so I was wondering when a patient does come to you for something like IBS, what is the usual thinking process uh, based on? I know it's a patient to patient basis, but what are you gauging to see if they're more suited for the probiotics or the harsher medication or a mix of both?
So I'm glad that you touched upon this. So probiotics are essentially, the good bacteria, which we can reconstitute in our colons just by eating a well-balanced diet. So I'm in the camp of, you know, eat the rainbow. You can do this on your own. If we become so dependent on a supplement, which may be great and providing you with certain good bacteria, there are micronutrient supplements with zinc, with turmeric, all of that is great. But an over reliance on supplements could end up making our main diet, the basis of our diet, perceivably unhealthy, right? Because we're countering it with ingestion of supplements. So in my practice, my advice to my patients is to eat a variety of plants. There was a big study that was done in the UK and the US where they studied the beneficial effects of eating 30 plants in a week. And what was seen was that had great results on gut microbiome diversity, health. And 30 is an arbitrary number, but by having a variety of plant-based foods, we can do the same thing in our colon that a supplement is doing, albeit the supplement's doing it in a limited fashion, and our diet can actually do a better job of it. Um, and just trying to keep it as staying away from ultra processed food, which is a known enemy. So eating plant-based foods, fruits, legumes, beans, seeds, these are all good things. Fiber, right, which will promote microbial diversity and allow our microbiome to produce probiotics naturally, which will produce the fatty acids that sustain those tight junctions, that would prevent toxins from entering and leading to inflammation and immune dysregulation. Um, and if your primary care doctor or your gastroenterologist has discovered a micronutrient deficiency for which they are recommending that you take a supplement, it's important to take a step back and see why you have this micronutrient deficiency to begin with. There's a whole myriad of real GI problems like pancreatic insufficiency, celiac disease, small bowel intestinal overgrowth, where there is a very real reason for why patients have a deficiency. So rather than putting a Band-Aid on it by taking a supplement, it's important to get to the root cause, treat that disease, and then get back on track by having this amazing plant-based diet. So that's my reply.
I feel like if everyone listened to just this past 2 minutes, maybe the whole supplement game would just go 100% down because I totally resonate with you, Dr. Khan. I believe the reason why there is even a small consideration of relying on these supplements is simply because it's just more convenient. But again, I do feel like just having the foods itself, they make it so that they're also more bioavailable, and it's a more natural process versus just taking a supplement. Earlier, I wanted to just backtrack just a
Yeah.
bit. Um, when we said the probiotics, prebiotics, and postbiotics, you did say the probiotics are the good bacteria, right? The good living bacteria.
Yes.
Yes. But then the prebiotics are the food for the bacteria.
Mm-hmm.
Gotcha.
Yes. So, yeah. So, good examples of prebiotic food would be like sauerkraut, kimchi, kefir. These are things that when you take them, they allow fermentation in the intestine. They're food for the bacteria, which are the probiotics.
Understood. And then what would be the difference between these prebiotics and fiber?
So fiber, so that's a good question. So fiber is fuel for the microbiome. We as humans do not have the enzymes from a ecological, from an evolutionary standpoint to digest fiber. But our microbiome, the bacteria and the fungi, they do have the enzymes, and so it's food for for the microbiome.
Understood.
And then when they use that as food, what they end up doing is they produce fatty acids, and the fatty acids are fuel for those tight junctions, which are so important for us. So it's a symbiotic relationship, but fiber is great. Fiber should be consumed in abundance.
Understood. And then what is the final one? Postbiotics.
Right. So postbiotics would be the fatty acids, which I mentioned, right? So
Okay.
when,
Right. Sorry.
yeah, that's what they're producing.
Understood.